Hey guys, welcome back to our channel Ocean of Dentistry. Today we are going to discuss about the Marfan syndrome. Marfan syndrome. See, in the series of syndrome, we have already discussed one more important syndrome, that is Pari-Robin syndrome. So today we have to discuss in detail about the Marfan syndrome. See, Marfan syndrome is also known as arachnodactyly. Arachnodactyly. Why? Because arachnodactyly means finger and arachno means long and thin finger. Okay, this is from the name of the syndrome. Marfan syndrome is a disorder of connective tissue. Why it is a disorder of connective tissue, how it is affecting the different organ, I will discuss within few seconds. Marfan syndrome is an autosomal recessive gene disorder. Autosomal dominant gene disorder. It mainly affects three areas, that is eye, CVS and the skeletal. Three organs are most commonly affected. Other than this, the lungs and blood vessel, because these all areas have much more connective tissue. So these areas are mainly affected. What is the etiology of this Marfan syndrome? In the Marfan syndrome, you will see that there is a mutation in the FBN1 gene. See, this FBN1 gene normally do what is they produce a protein that is fibrin. Okay? This fibrin has a role in the stabilization of the myofibrils. Okay? And that myofibril is present in the connective tissue. Okay? So when there is mutation in the FBN1 gene, which is located on the chromosome number 15, Q15 and Q23, 9q15 and 23, where P and Q are the long and short arm of the chromosome. So once there is mutation in the fibrin, it leads to the defective myofibrils, and that defective myofibril lead to the defective connective tissue, and that further gives the disorder symptom in the eye, CVS, skeletal and lungs and the blood vessels. Okay, so come to one by one the different feature on the skeletal. I will compare the eye and the CVS. In the skeletal, you will see there is a tall stature. Other than this, you will see arachnodactyly, long and thin finger, hyperextensibility of the joint. When you will see check the patient, see, you have the resistant, but in the patient of arachnodactyly, this thumb will completely move to this side. Okay, means this is a very hyperextensible joint will be seen. Other than this, the face and the skull will be long and thin. Face size and the skull size will be very long and thin. Flat feet will be present. Other than this, you can see there is a high arch palate, so the denture fitting will be difficult. इसके अलावा you will see there is a scoliosis and kyphosis. Okay, so there will be slipping of vertebra also seen in the case. Pectus excavatum, you will see this pectus excavatum is also seen in the case of ricket and the pigeon chest like disorder. Dolichostenomelia, what you mean by this term dolichostenomelia means the person limb is much more larger or bigger than the trunk, means the trunk size is smaller in comparison to the limb. This is known as dolichostenomelia. On the eye, the most important defect that is going to occur in the eye is dislocation of the lens. See, you will say that, sir, dislocation of the lens was also seen in the case of homocystinuria. My dear students, dislocation of the lens was, you are right, that seen in the case of homocystinuria, but the dislocation pattern is different. In the homocystinuria, you will see there is inward and downward dislocation, but in the case of Marfan syndrome, you will see upward and outward, means a classical picture that you are seeing in the pop-up button. You will see the classical picture, or even you are in our group on the Telegram, where I will share the picture of the Marfan syndrome patient. You will see a very classical picture of that patient eye lens. The patient will have cataract. Other than this, the patient will have lens difficulty problem. Other than this, the patient will have retinal detachment. Okay, myopia will be seen. In the CVS is a very life-threatening condition, the main reason for the morbidity and the mortality of the patient. So in the morbidity and the mortality of the patient, why this happen is, in the CVS, when it affects the CVS also has connective tissue in the blood vessels, so aortic regurgitation can be there, aortic dilation can be there, incompetence of aorta, mitral valve prolapse. When this all happen, it finally lead to the heart failure, because when the mitral valve will prolapse, there will be heart failure condition, aortic regurgitation, heart failure condition. Other than this, murmur sound can be heard. So this is the condition seen in the case of patient of cardiovascular difficulty. Now, every year the oral manifestation is asked in the Viva, and this is a very important syndrome. It can be asked as your short note or in the Viva. The notes will be discussed or will be shared with you in our Telegram and Instagram page. Please go and join our page from there. Link is given in the description. So come to the topic. Oral manifestation. In the oral manifestation, first I have discussed with you is the high arch palate. Sinus will be enlarged, maxillary sinus. Other than that, there will be enlarged frontal sinus. Skull height will be increased. Okay. So this was all about the Marfan syndrome. Now come to the treatment. Being a doctor, you have to treat the Marfan syndrome, but the treatment will be symptomatic relief. See, any genetic disorder has mainly the symptomatic relief. So there will be multidisciplinary treatment. If the skeletal is only affected, then only the skeletal problem will be treated. If eye, skeletal, CVS is affected, then all the three will be coordinated and will be treated accordingly. If there is CVS problem, then you will have to go for the antihypertensive drug like beta blocker, that is propranolol, atenolol, temolol. Other than that, you will have to go for the ACE inhibitor like captopril, enalapril, calcium channel blocker, GTN you have to give the patient. You can also use digitalis, digoxin, etc. for the treatment of the patient. In the case of eye, you will suggest the patient for the surgical cataract removal and surgical correction of the eye. Other than that, vitamin supplement, connective tissue fibrin supplement can be given to the patient. The patient should be advised that he should not go outside in the night as without any one person along with him, because there is a chance that he may got injured, and since due to the lack of connective tissue fibrils, so there is a prolonged bleeding, and that will cause in a severe condition shock also. So this was all about the Marfan syndrome. Hope this video was helpful to you people. If it was so, please do like, share and subscribe to our channel Ocean of Dentistry. The Hindi version of this video has also been uploaded, and for notes please do join our group from the link given in the description. Facebook, WhatsApp, Instagram, every link has been given in the description. So please do like, share and subscribe to our channel Ocean of Dentistry. Again, thank you all. Keep supporting us and keep your study on go. Hup hup hurrah.